there's a stroke every 4 minutes in this country. It's the third largest cause of death and injury in the world. In the US, there's a stroke every 40 seconds, and it has an inverse care law pathway. In other words, those people in need of health and social care, stroke the most, tend to get stroke more often, and their recovery is terrible, basically. So we thought we'd focus on stroke as an example of what we can do when we put technology in the role of patients. So what we're going to do now is have a conversation, basically. Might be a bit weird, but it is going to be a conversation. I promise you. And I'm going to start by just asking people to introduce themselves and say who you are. Perhaps Jenny, you want to start with you, Jenny, and then we'll come to you, Paul. And then this is all about you, so I'm going to talk to you a bit.
Wish my wife would say that.
Thank you very much, Victor. So my name's Jenny, and my daughter had a brain injury a few years ago. And before that, we had no idea what would happen to somebody if you have a stroke or a brain injury. It was completely new to us. Once she recovered, we realised that there was no recovery really for anybody. And so we decided to start a charity, and we call it Same You, because everyone who has a brain injury or a stroke or any other life-threatening problem just wants to let everybody else know that they are the same as they always were. But people and society don't treat them that way.
Right. So, Paul, we met in London a while ago at the launch of the sort of Same You Visionable story. And I just want to tell people about your story, really, and what happened to you and how Same You worked with you.
Well, the first thing is that one of the things about stroke is I'm no longer as precise or short as I was, but I'll do my best.
Who is? I mean, I'm sorry.
But I was a foreign correspondent for 20 years.
Yeah.
Been through war zones, fine. Then I was in charge of major organisations, communications, the BBC, University of Cambridge. I was invincible. And then I had 2 strokes. And at first I couldn't even speak English. And I had fantastic treatment in hospital. And then, without Same You, I don't think I'd be here. Mm. And I'll just give you a little view, and then I had 2 strokes because of COVID. And I wrote an academic paper afterwards, because whether it was the sort of strokes or whether it was COVID, there were 10 people who had the same thing that I had. Of those 10 people, 6 are dead. 3 are in hospital. They're in a catatonic state. They're not aware. They can't speak. And there's me. And part of that was the astonishing medical care I got, which accidentally was very much like what you're saying here. And the second is Same You rescued me. So I had end-to-end care from the moment I had strokes. As if I'm here today, I'm an example of what you will achieve through this initiative.
Would you say that you were lucky? Tell me a bit about that luck and what Same You did with you. How did that work?
Okay, so the first thing I was lucky is my daughter. She got her own back, because I'd always complained that as an obs and gynae consultant, she was no bloody use to me. But she was the one who said, go to hospital. And I said, I'm all right. She said, go to hospital. I was at UCLH. I had no memory of what happened for 4 weeks. And during that time, I had COVID, then I had 2 strokes. Again, I was incredibly lucky, because as I came out, a couple of doctors thought something was strange. And they rang up the consultant and asked him to come back in and look at me. And he was there, and he put me on massive blood thinners when I had the 2 strokes. I would not have survived without that. Mm. When I came out of hospital, and this is no criticism of the NHS, I'd had a couple of days of physiotherapy. They wanted to make sure I could get up the stairs to my bedroom at home. And I got this phone call saying, yep, your therapy starts on Tuesday, and there'll be 8 hours a week, and there'll be the cognitive, and then there'll be the physical. And it was Same You. And Same You saved my life. And I wander around and people say, well, there's nothing wrong with you. There are hidden deficiencies. But the fact I walk around, that I can be with my grandchildren, one of whom I'd never seen, is thanks to the medical system, but critically, thanks to SameU. And what we're saying here is, I think, exactly what saved my life.
I mean, I've looked you up. You're a Renaissance man. You're very modest, actually. You weren't just any reporter. You were at the basic cutting edge of communications and what have you. And I'm just wondering, Jenny, just say a bit more about the struggle. Sort of when you've talked of Visionable, it's been about practical things. How we get the centre set up. How can technology work? Just say a little bit more about what you're trying to do, and how does Paul represent that? And then I'm going to ask you, Alan, to talk about Visionable's piece, if that's all right.
So, when you have a stroke or a brain injury, you have multiple complex problems. We were very lucky that when we went through it, it seemed to pan out all right. If you think that you've got a brain injury, you automatically think there's something wrong with your brain. Your brain has let you down. You've got a systematic problem in your head. Your brain is not just another part of your body. It is the place where you can actually say it's your identity, and it's your start, middle, and end to everything. When people are trying to recover, at the moment, there is very little funding put into rehabilitation. There's no actual concept of the word recovery in neurological teams. What we see is that if you have a problem with your arm and you have wonderful repetitive therapies that technology can really enable, that's great. And if you can, pick up a cup because you've repeated the process 10,000 times or 10 million times, it doesn't necessarily make you feel like a whole person again. So the idea about rehabilitation and recovery that everybody has got to understand is that doing one small thing at one small part in one small clinical piece is not enough. Everybody has got to be treated as a human and as a person. And so what we tried to do is to certainly let everybody know that this is the case. We have thousands and thousands, tens of thousands of people have contacted us and have told their stories. So it's all about not just our story, but it's about their stories, and like Paul. And so what we see is that the emotional recovery, mental health recovery, if you like, there's no real words to describe it because these are words that don't come easily to people after a traumatic injury. And so is it recovery, is it rehabilitation, whatever it might be, but emotional and cognitive are so interlinked, and people understand when you've got physical disability, but it's the mental health aspects that's absolutely vital.
Alan, so just explain to us, why is stroke so important to Visionable, and what are we doing? And I know it says on that thing, Linda Simpson.
I'm a substitute. So Linda was meant to be here today, but she got the flu this morning and called up and said, obviously, we said don't come if you've got flu. So I just want to talk a little bit about Linda's project. So when I worked in the NHS, I worked with Linda, who's just a superhuman being. She was chief nurse. And there was a problem around the acute services of stroke. So in East of England, they didn't have enough stroke doctors to provide 24/7 care. So that was the problem. And what we looked at was, well, why can't we have one stroke consultant at home who can attend every one of these hospitals remotely? And at the time, this is 2010, unreliable, but what's the alternative, right? And we're getting to that on mass scale now. What is the alternative? So Linda, she's just a superhuman being that just passed through so many barriers of, IT saying you can't do that, clinical governance, clinical risk. This service has been going 10 years. It's treated over 5,000 patients where they would have had to stay in an ambulance and be, traveled another 100, 200 miles to, find the doctor almost. So this example has now been 10 years. It's a process. It's the way everyone works. It's now being evolved. And the great thing about great projects in the NHS, year one isn't great. Year two is better. Year three, you just take the learning and you evolve. You're not going to change it overnight. You know, so what Linda's now done is after treating 5,000 patients, they've added AI, they've now connected the ambulance, they're now, how can the whole thing become part? So we're very proud that that's Visionable technology that partners that, but we work closely with Linda. We're now doing this. I see Mark here, we're doing work in Wales and so on. But this is just an example of perseverance by one individual who has managed to save 5,000 lives. So if one nurse with a bit of passion can save 5,000 lives, she's my superhero. And I think we've all got the potential to do that if we all get out, you know, because the problems that exist, let's be honest, if it was your mother or your child, you'd move. So, and I think that's the power of that.
So people can see, hopefully, the connection between SameU, Paul's story, and Visionable. Yeah. But it's not just the lives that we've saved, because we did the analysis, I can't remember which university it was, because you all got a university involved, and the average time that someone spends in hospital in the east of England was about 17 days, and it's now been reduced as a result of this connectivity and this platform to 2 days, I think. It's 2 days, yeah. And we've increased thrombolisation rates from 1% to 40%. Now, that's without all the bits of technology that Visionable can connect because of the uniqueness of the platform. So Brainomics, who are here today, have a brilliant piece of tech which actually enables clinicians to see what's going on in the brain and decide whether you need thrombolisation or thrombectomy. So there's a connection between the human, the technological, and the outcome, and that's what we wanted to kind of illustrate today, and I think we're getting across.
And I think just to add on that, I mean, Jenny, you can talk, during COVID, where people couldn't go to the hospital, was a really difficult time for patients, and you managed to stand up a recovery platform. And
it'd be really good if you could say something about that, because that's really impressive.
So, well, Paul can much better than me, because that's how we know each other. So when we started working with UCLH, with a big vision for a huge rehabilitation treatment centre. And then COVID came. And so they said, right, we've got to get all our stroke patients out of the wards and back home within 2 or 3 days, and it's not safe. What on earth can you do to help? What can we all do? So we all sat down and said, obviously technology. And they said, why? How's that going to work? So we managed, because of COVID, and because you remember right at the beginning, everything was pretty chaotic. And so we sort of slipped through lots of the tape, and we were able to create a process with all the therapists. So they were not able to have any stroke patients in their buildings, and so we did it all online. And so it was group tele-rehab, which was really innovative, because the therapist said, right, well, I can do one-to-one, but that wasn't going to be good enough because there was too much volume. And so we had up to 20 patients at one time, and we had all the different therapies. We also had a carers clinic, a carers cafe, and we had neuropsychologists, we had physiotherapists, we had speech and language therapists, and people together. And maybe Paul can talk about the peer group that now exists.
Yeah, the experience of it, I guess, and the peer group. Yeah.
Well, the first thing I'd like to say before that is that what you're describing is what I luckily had.
Yeah.
Luckily because I was in London, luckily because my daughter was a doctor, luckily because of the time. So my stroke happened on the doorstep of UCLH. My second stroke happened when I was already being treated by the doctor with blood thinners. The consultant continued to talk, still talks to me today. And so I had what you're offering to people. I had somebody talking to me, somebody looking after me the whole time. But I had it because I was incredibly lucky, because I was in UCLH, I was walking, if only everybody could have what I had. And, here's where my memory goes. The second bit you wanted me to answer.
No, I was just interested in the experience of the service that was put in place during COVID. The group service and how that
again,
works.
As I said earlier, I got this phone call saying you're doing this, and I thought, well, it's great, fantastic. I didn't imagine for a moment, I didn't understand who was behind it, but it was vital. I mean, I'd been a foreign correspondent. I'd been a national level athlete. I'd done all these things. I wasn't bothered by anything. People shot at me. People tried to blow me up. Fine.
It's the people shooting at you bit that I'm impressed with.
It's all right. The one thing about people shooting you is you've got to make sure they miss. Okay. But I wasn't frightened by anything. I wasn't worried about anything. And then I had 2 strokes. I was no longer the same. But thanks to Same You, I started to believe I was the same. And it's this wraparound care that I got. And I'm not blaming the NHS, apart from the fact that my daughter would kill me if I did. But it was because it was there for me. It was there thanks to Same You. It was there thanks to an individual consultant. Yeah. And I'm passionate about the idea that why should I be the person who gets it? Why can't we offer this wraparound care to everybody? And the group that was put together by Same You, we talk every week. And we support each other and we have a chat, unfortunately occasionally about football, but we won't go there. And we chat about problems and how we can help each other and what we can do. And this is a group that I believe will continue. And it was thanks to Same You that we got it. So we got end-to-end care, a group of people to talk to understand, and in my case, again, access to a superb consultant, more or less whenever I want, which is what you're offering. I was lucky.